Think allergies only cause sneezing? They can also contribute to itchy or watery eyes, nasal congestion, postnasal drainage, cough, seasonal sinus pressure, and certain skin symptoms. The first step is not guessing. It is matching your history with the right type of testing. Depending on the situation, an allergy evaluation may include skin testing, blood testing, environmental review, and consideration of other conditions that can mimic allergy symptoms. Testing should answer a clinical question. A positive result does not automatically prove that an allergen is causing every symptom, and broad testing without context can create confusion. At Fusion Health, the goal is to identify relevant triggers and build a practical plan that may include avoidance strategies, medication, environmental changes, or immunotherapy when appropriate. If symptoms keep returning every season, schedule an allergy evaluation.